Neonatal Substance Withdrawal by Carmela Wheeler, Jessica Layfield, and Maddie Benson. What is neonatal substance withdrawal? Intrauterine drug exposure can cause fetal anomalies, neurological behavioral changes, and evidence of withdrawal. So basically, when a mother uses any type of drug or even alcohol during her pregnancy, it can have huge effects on the baby.
The most abused substances are opioids, methamphetamines, methadone, marijuana, and nicotine cigarettes. Signs and symptoms of withdrawal in babies is very similar to that of an adult. The classic signs and symptoms include tremors, seizures, sweating, fever, diarrhea, nausea and vomiting, poor feeding, high-pitched cry, and slow weight gain.
Opioid withdrawal is a complex biological phenomenon on a cellular and molecular level. The pathophysiology of opioid withdrawal in neonates is even more complex due to the immature neurological development, impaired neurological processing, and complex maternal-fetal-placental pharmacokinetics. Complications include withdrawal, sleep disturbances, ANS and PNS dysfunction, and GI dysfunction.
Many mothers sadly use methamphetamines during their pregnancy. The caudate nucleus is mainly affected by exposure to methamphetamines in utero, which is the part of the brain that controls learning, memory, motivation, and motor control. Studies show that meth, along with other substances, affect the growth of the brain tissue and sensory development. Complications with using methamphetamines during pregnancy include the baby going through withdrawal, having a stunted growth, so very small babies, having developmental delays due to the caudate nucleus being affected, along with behavioral problems, a dulled stress response, so the baby may seem as though it's unaffected on any environmental stimuli, and then mood disorders such as bipolar disorders and stuff that may show up later in life with the baby.
Due to the inability to cope with external stimuli, these neonates should not be rocked, patted, or exposed to overly stimulating environments. Complications with methadone withdrawal include seizures, abnormal sleep patterns, higher birth weight, and withdrawal.
Marijuana is a drug that a lot of women use in pregnancy, especially with its legalization in some states around the country. Many women feel that marijuana can ease morning sickness or headaches. Marijuana use is also common after parturition, further exposing the neonate. Unlike other drugs, evidence has shown a decreased amount of maternal THC compared with the amount of fetal THC. Complications that can come out of using marijuana during pregnancy is a low birth weight for the baby, hyperactivity disorders like ADD or ADHD, a miscarriage if used soon enough, a preterm baby, which ties in with the low birth weight, and then a stillbirth for the baby.
Neonates exposed to nicotine exhibit neonatal abstinence withdrawal syndrome mainly in the first 24 hours of life. Complications include prematurity, small for gestational age, increased risk for infection, developmental delays, and increased risk for SIDS. Non-pharmacological treatment includes gentle handling, high-calorie diet, pacifiers, kangaroo care, consistent individual care, low external stimuli, rooming in, and education for parents. Pharmacological treatment includes morphine, methadone, Narcan, epinephrine, IV fluids, and parenteral nutrition.
Which substances are the top abused substances by mothers while pregnant? Select all that apply. Aspirin, meth, Sudafed, nicotine, marijuana, or opioids. The correct answers are meth, nicotine, marijuana, and opioids. The rationale for this is that all of these, along with methadone and alcohol, are some of the most abused substances during pregnancy. When educating parents about how to care for a neonate born with substance withdrawal, which statement by the parents indicates the need for further teaching? We will cluster the care so the baby can rest as much as possible. We don't need to limit visitors or external stimuli. We will provide kangaroo cares, or we will be consistent with who cares for the baby. The statement that indicates the need for further teaching is we don't need to limit visitors or external stimuli. The rationale for this is that the care of a neonate born with substance withdrawal needs to be able to rest and be calm. Visitors and external stimuli need to be limited to provide the best environment for the baby. Clustering cares limits handling of the baby that may disturb it. Kangaroo cares and consistent cares from the same 1 to 2 people helps the baby stay calm and feel safe. These are our sources.